Did you know that low back pain is the #1 disability across the world? Over 60% of women have it and 40% of men. Here are 4 tests you can do at home to determine if you have low back pain. Posture is a great way to determine if we have low back pain. Stand in front of a mirror. When you stand in front of a mirror, you should be looking straight ahead, shoulders level, hips level. If you have low back pain or a disc issue, you will have a lean away from midline. That will indicate an irritated disc or definitely low back pain. So another test you can do at home to test to see if you have sciatica is called your slump test. So the slump test is where you're going to be sitting on a chair. You want to flex your head forward. You want to hunch forward with your mid back. Extend your leg where the pain is going down. Bring your foot towards you, and if you feel nerve pain down into your leg, that's an indication of nerve tension or sciatica. If you rotate your foot out and it relieves that pain, that is not sciatica, that's more of an impingement of the muscle called your piriformis. The next at-home test is the McKenzie's test, where that test is determined if you have a disc issue or a joint issue. How we perform that test is you're going to be laying flat on the floor. All right, so what we're going to want to do is we're going to want to get up on our elbows, almost like a half cobra. You want to keep your pelvis flat on the ground and extend your back. If you're having pain in your low back from here, that's the indication of either, like we said, a disc or joint. If you have no pain there, we want to go to full extension, where you will get up on your hands like into a full cobra, trying to keep your hip flat to the ground if you can. If there's pain there, again, it's indicating of either a disc problem or a joint problem. So another test is called a lumbar sensory test, where you can do at home. So if you're experiencing any sciatic pain or neuropathy, tingling and numbness down your legs, and you feel some changes on either one of the legs, you can do this simple test at home, where you would take a sharp object, kind of like a toothpick of some sort, and then on your most non-painful foot or leg, you're going to want to poke around and see if the sensory or the input to that is the same where you're poking. From there, you'll go to the opposite foot, the foot that has the most pain or discomfort, and poke around to see if there's any sensory changes. If, for example, Kristen's left foot is more numb or dull, that will indicate there is compression on that sensory nerve in that foot, therefore has a disc and nerve issue. Your spine is the foundation to your health. So if any of those tests were positive, give us a call today to see how we can help.